This is Plastic Surgery Uncensored with your host, Dr. Roddy Raban. I'm Monique Marvez, and the topic today, which I'm very fascinated by, because at the end of the day, you get to pick who's a good candidate for plastic surgery.
Yeah, I think that's the art form, or where art blends into integrity, and I think that's where the lines are being blurred today, is determining who you feel as a surgeon you're going to be able to help. Right? The goal of this whole plastic surgery thing is make someone better, right?
You would hope.
Hippocratic oath is do no harm. Well, the problem is that we all know, we see it on TV, and we all know that there's people who are getting surgery done and they don't look better. They're much worse. And the question then becomes, at least for me, is this person a candidate? That's the question. Is this person a candidate? So a lot of people ask me, how do I decide? How do I decide who's a candidate? So there's no rule, and it's basically a matter of figuring out their candidacy. So issue number one, everyone asks me about age, right?
Of course. Because nowadays, people who are getting nose jobs, 12, 13, isn't your body still growing?
So the oldest patient I've ever operated on is 100, and the youngest patient I've ever operated on is 6 months.
I'm going to have to ask you to elaborate. What did you do to a 100-year-old?
So my point
was she on match?
So my point by telling you that I operated on a 100-year-old woman and I've operated on a 6-month-year-old is to tell you that the age itself is not absolute. It's what you're doing to that person and their health that makes a difference. The 100-year-old woman had burned her leg, and I had done a skin graft, and the 6-month-old was...
So a 100-year-old woman cared that she had a burn scar?
Well, she needed to fix her scar because it wasn't a scar for cosmetics. She had an open wound, and I was taking care of her wound.
Got it.
She was 100 and healthy, and she could tolerate that surgery. I operated on a 6-month-old because I did a cleft lip and palate in one of my many missions, and that child could tolerate it. The issue is not if you're 100. The issue is, can you tolerate the surgery? So from a health standpoint, from an age standpoint, it's more about health. So in the elder spectrum, people always say, oh, what's too old? What's too old is when you have medical conditions that prohibit you from doing it. I would rather operate on a 70-year-old woman who's healthy and who does a marathon once a year than to operate on a 50-year-old gentleman who's got heart disease and had a stroke and diabetes. So the age is not an absolute criteria.
The candidacy is general health.
General health. Second, the candidacy is mental maturity. So people talk about age. So what's the youngest you've ever done a rhinoplasty? Well, the structural entity, the anatomy, is we generally don't operate on a young girl earlier than 16. And we don't generally operate on a young gentleman earlier than 17 because they're structurally mature. But I have had many 16-year-olds come into my office who behave like 10-year-olds. And in the conversation and dialogue with their parents present, you can tell that this child is very immature, better yet, this teenager. And there's no way in hell I'm going to operate on this person and then to go through all the dynamics of casts and cast removal. So yes, there's an age issue, but then there's a huge maturity issue.
So psychological, we're back to the psychology because plastic surgery, and also you have to determine if they're going to be a compliant patient, right? Because there's follow-up to this.
So that has a huge part of it. So the psychology of it is making sure that this person, and the next issue is whether or not they're registering, whether or not they're tracking. You and I talked on many occasions about the consult you had with me, and you said to me, like, holy shit, I can't believe it was so much more
so
thorough and complex. That's my style. That's my nature. So if I leave a consultation and you have glossy eyes and you strike me as you're just not getting it, I cannot operate on you. Why? Because I get the worry that you're not getting or comprehending what I'm suggesting. You won't do the follow-up that I'm asking. And at the end, the worst thing that could ever happen in plastic surgery is that you're unhappy.
Well, that's in life in general.
But what if I operate on you?
Right.
And you come back to me and say, oh my God, this is not what I asked for. But you and I had spoken for like hours before about what our goals were. So if I don't feel like you're tracking or following what I'm saying to you, it's a lot.
You're very specific in your consultation.
So the reason I'm specific is I'm weeding out. That's the reason I'm specific. If I speak to you generally, then all of you are candidates. Hey, do you want to enhance your breasts? Do you want them to be bigger? Do you want them to look really sexy and pretty?
Let's do this.
Hey, awesome. But if I say to you, you know that you could lose sensation in your nipple? How about capsular contracture? You could have bottoming out. If you start panicking.
Bottoming out? That sounds terrible.
Right. If you start panicking and then you're telling me you're already self-selecting. So another reason is that are you tracking component?
Now, can you tell if somebody's going to be non-compliant? This is Los Angeles. When you talk to people, how much, and I'm just going to say it, how much does drugs and alcohol come into play of you saying, I believe that this person's not being authentic with me. This person may or may not drink more than they're admitting to, or smoke cigarettes, which you said affected circulation, or is on some medication that could affect. I mean, you have to discern that as a doctor.
So what you need to do is you actually need to talk to them. You actually need to question them and specifically address issues. So I'm the type of person, my consults are an hour. You cannot do this information gathering, learning about the person in 10 minutes.
No.
So what happens is I'll ask you questions, and then
you ask me a lot of questions.
Right. And then I'll dig further, and you'll say something to the effect that, I occasionally take some anxiety medications. And I could just leave it at that. And I'm like, who gives them to you? Oh, my doctor. Which doctor? And then as I start to inquire, I start to dig down a rabbit hole. And then I come to realize that you, say, for example, are abusing Xanax. Okay, I'm not here to be the interventionalist, but I'm here to tell you that, until we've addressed this issue, I can't operate on you.
Until you talk to Jeff Van Vonderen.
Right. So and then every patient who we're going to operate on goes through a very thorough medical clearance.
Sure.
Another issue for candidacy is if you're already look amazing and you're asking me to make you amazing plus, I'm not going to operate on you. So this is really an important concept that people really don't understand. I have very often patients, let's take the nose, for example, beautiful supermodels who come to my office with,
I have a little bump right here on the side.
Who have otherwise stunning features.
I have friends.
With a small blemish, nothing wrong with the masking. Hey, by the way, Dr. Raban, I love my nose, but I have this tiny little bump. I'd like to get rid of it. In my world, that's the worst candidate. This is the reason why. Their argument is, I've seen what you can do with some of these other noses. I'm sure my nose will be easy. It is the exact opposite. When you're operating, you're relying on the margin of error. So when you're starting out at 94th percentile and all we have is 6th percentile to improve, you're not giving me a lot of room for improvement.
No.
If you start at 70th percentile, I got a lot of options here to get you better.
No, you want Sasquatch in here.
So the reality is that when you start out beautiful, you have more risk of making the patient worse than you do better. So I'll definitely pass on those. I won't operate on those patients. I'll give you a perfect example. I had a patient that came in from out of town. Her and her husband wanted to have their noses done. I saw
his
them.
and her
Yes, his and hers. I saw them both. And I said to her, I don't really think she's a great candidate. And she said, why? I said, because your nose is perfect. I mean, you're beautiful. I don't know how much, I can make it a little better, but it's not worth the risk, at least to me. Her husband had a terrible nose. And so I operated on her husband and I saw him and I said, what happened? Where's your wife? He said, she just had her nose done. And I was like, yeah, your wife just had she had her nose done. So she had gone elsewhere. And trust me on this. If you get a no from a surgeon, you will find someone to do it. That's not an issue. Of course you will. So that's one end. And on the other end is when someone comes in, and again, let's just stick to the nose. And I don't think that I can make them much better. Like there are certain features. Let's say you have super thick, oily, sebaceous, acneic skin. Thick skin. Mm-hmm. And you hate your nose. And I totally empathize with you. There's nothing I can do. I can lift up the skin of your nose, do magic, and then put the skin back and you're going to look the same. Or you're on your fourth revision breast catastrophe, redo, whatever, and you come to me as your Messiah and Savior. I can't help you. Even if you got a suitcase full of unmarked bills, there's nothing I can do to make you better. So for me, candidacy, in a nutshell, is being able to make sure that when we're all said and done, you look better, not different.
Okay, well, when you were talking about the gal with the wound, the 100-year-old, what's the oldest cosmetic person that you've actually worked on a beautifying process?
I've worked on an 80-year-old before.
And what did you do?
I did
to
a
her?
Facelift.
A facelift on an 80-year-old?
Yeah, of course.
And did she look?
She was an 80-year-old that could kick my ass. Right. So my criteria is if we arm wrestle, if you can beat me, then I'll operate on you.
I'll let my mom know.
So she was awesome. She was literally on just vitamins, and I'm sure she'd live to be 110.
And she looked great when you were done.
She looked great, yeah, because she was a good candidate.
And she was excited.
Just because she's 80 doesn't mean she gets a facelift. She needed the facelift. You follow what I'm saying?
Right. 80s. Had she done anything prior?
She had done a facelift before. So
she'd done another one.
She had done one previously, and so we were revising her facelift.
Well, at 80, it's time.
It's time.
Yeah.
Time but she needed it for another next 20. She needs it till she's 100 for bingo.
Yeah, and she kept it. The rest of the car was in good shape. So you just fixed the.
That's it.
Yeah. Okay. Dr. Raban, when we come back after this break, you told me about the woman that you said no, and she went and got the rhinoplasty anyway somewhere else. Clearly, people don't like to hear no. It's not in our society. We don't like no. So when we come back, I want to hear about some of the no's that you had to deliver, how they landed. I'm sure those are great stories. We're back with Plastic Surgery Uncensored with Dr. Roddy Raban. I'm Monique Marvez. I want to hear about when you say no to people, specific stories of how they take it. Nobody comes to a plastic surgery office fully prepared to pay what it costs to have the doctor say, nope, no can do.
Yeah, listen, we have a saying in our society, American society, is never take no for an answer. Right? And so as a result, especially when you're paying, I think it's one thing when you're trying to get something and someone rejects you, you keep trying. But for me, the worst thing that could ever happen is I operate on you, knowing well myself that at the end of the day, you're not going to have an outstanding outcome, and then having to deal with the consequence of that. So I tell people no, which I do quite often, probably maybe, I don't know, I would say maybe 20% of the consults.
Truly, 1 in 5 people.
20% of the consults we see, because we see a lot of different people. 20% of consults we see, and this is after we filter them. Sometimes they send their photos and we tell them no online so that we don't have to waste their time. We tell them no. So let me give you an example. So I have a patient of mine, I did her nose. She came to me one time and during her follow-up, and she said to me, Dr. Bond, I really want to have liposuction of my abdomen. And I looked at her, and she had a few kids, and I said, to be honest with you, I don't think you're a really good candidate. You have a little bit of loose skin. You don't have that much fat. Most of your fat is visceral, meaning it's inside your abdomen. And if I liposuction, you're going to get a bunch of irregularities. I wouldn't do it. Just go do a little diet and exercise. I think you'll be fine. So one of the areas that I do a ton of no's, is in the liposuction arena, because the liposuction candidate is very specific. Super great, tight skin, small amount of fat removed. How many people do you think that is? 1 in 1,000. Everybody else is either super skinny and wants to be skinnier, or super overweight and wants to be skinny. So anyways, time goes by, and then all of a sudden she comes for one of her follow-ups and she's in tears. And I said, what's going on? And she said, I need your help. You got to help me. My husband's going to kill me. What's the matter? What's going on? She lifts up her shirt and she's got like the most horrific, honestly, her abdomen looks like leather. And I said, what happened? And she's like, I just came back from Colombia. And I said, and she's like, I was there visiting my family, and I went with my friend to one of her consults, and the doctor there, I just happened to ask him, and he said, oh, no problem. I do this technique of like ultrasound, high def liposuction. And he said it'd be no big deal. I do it under local. And I really didn't think, Dr. Raban, and this is my belly, and I've come back and my husband wants to kill me. And please help me. Nothing. I can't help her. There's nothing to do. Her abdomen, they'd sucked out all the fat. Her skin was like leather. It was all inflamed from the ultrasound energy. It was a catastrophe. And she was in tears. And I was just like, I wish I can't help you. So that's an example when it comes to liposuction and people not listening. I had a patient. She was a celebrity, a very well-known celebrity. She came to me. She's young. She's overweight. She's got a beautiful face, because when you're a little fuller, your face is young. She's under the pressures of all of this sort of media, whatever. And she said, hey, I'm thinking of having a facelift, a mini facelift.
What?
I was like, are you crazy? Shut up. She was coming and I was doing Botox and fillers for her, which is appropriate. She was under 40. And I said, no, that's insane, like insanity. I didn't even take it seriously. Anyways, again, on one of her follow-ups, she said, hi, could you do me a favor? I need some help from you. I said, sure, what do you need? She's like, I need you to do a scar revision for me. I said, sure, where is it? She pulls her hair back in a ponytail, and she has these literally like ropes, like rope thick scars on the front and behind her ears. And I said, what the because I had a good relationship with her, at least. And I had a good relationship with kind of like a brother.
I like that you drop the F-bomb once in a while. I've heard you say
that. And I had a good relationship with her, kind of like a brother. So I knew she was embarrassed, and that's why she didn't tell me. And she's like, I went and did one of these lifestyle lifts. She went to one of these and she could have afforded to go anywhere. And she went and had one of these lifestyle lifts that were on TV.
What does that even mean,
it's like a lunchtime facelift, mini invasive. There's 1,000 of these. Short scar, lunchtime, mini facelift.
Sounds like BS.
It is BS, but when you want something, you're willing to overlook the label. So she had it, and of course, there was not a lot of skin to remove, so it was really tight, and she had thickened like ropes, and she wanted me to cut it out and revise her scars. So that's another story. And I'll end with this.
Did you end with no? Did you tell her I couldn't do it? Or
no, I could revise her scars, but would it ever look like a normal face?
No.
Never. And the last story I'll leave you with, and it's just yet another anecdotal situation, was a gal who came to me and she wanted a breast lift with implant. And I had said to her, I said, listen, based on your frame and based on your parameters, you really can't be any bigger than probably a C, full C at the most. She was very petite, very tight. She'd had a few kids and sagging. She said, but I really want to be a full D. That's what I want to be. I said, I get it. I understand. Wonderful, whatever. I can't do it. There's no space. Can't fit the implant. Anyways, long story short, she disappeared into the woods as most of these patients do. And I'm not kidding. A lot of these people resurface. I could tell you stories for hours. She came back and she had come back to me 10 days after having had surgery. And she came into me and she called the office. She said, it's an emergency. I have to see Dr. Raban. I had breast surgery 10 days ago and I need to see him. And squeezed her in and I went and saw her and she's like, my right nipple is black. Is this normal? I looked at her and I said, no, it's not normal. And she's like, my doctor said that I just need to leave it, give it time. It's going to get better. And she had a dead nipple. And what had happened was she went somewhere. She said she wanted to be a D or whatever the hell she wanted to be. And they said, okay. And they shoved in a huge implant into her breast and did a lift simultaneously. And that blood supply to that nipple, you're not made out of Play-Doh. That blood supply to the nipple didn't make it enough and it caused it to die. And the nipple blackened and it died. And there's no fixing that.
A dead nip is bad.
That's it.
Wow.
So anyways, nothing I could do for her. And that was the end of that. Of course, I didn't see her again. And the story goes on and on. There's nothing would make me happier than to operate on you, make money, and pay for my bills. Are you kidding me? You know how much this office costs in Beverly Hills? But if I tell you no, there must be a reason, and it isn't because I'm getting brownie points. You need to heed the warning of surgeons around the country. If they tell you something, you really need to listen carefully. Because if you keep going, you're going to find someone that says yes.
There's a guy in New Orleans that puts boobs on boys. I mean, you know what I mean? You're always going to find that guy.
So anyways, those are my philosophies on no. Hopefully people will listen and pay attention.
I'm out there to tell you that if he says no, I would take him very seriously. This is it goes so fast. Another Plastic Surgery Uncensored with Dr. Roddy Raban. I'm Monique Marvez.